It is very painful, but also some people can't completely make a fist, but also some people can't even straighten their finger. This laser really just helps speed the healing process up. This video is for those of you that have a finger that bends like this, and you just can't straighten it out. It's called trigger finger. So we're going to talk about trigger finger, why you get it, how to resolve it, how to fix it, how to treat it, and let's go into that right now. Trigger finger is inflammation of the tendons in the fingers, and Mandy here has trigger finger. So we're going to use her as a little guinea pig and an example here in our video, so make sure you thank Mandy here. So she gets, well, why don't you explain what kind of feeling you get in your finger?
It's just like it's very painful. I can't even make a fist. Can do it with my left hand, but not my right hand at all.
Mm-hmm.
And the pain isn't as bad today as it was yesterday, but you know, it feels very debilitating sometimes.
So
the pain comes and goes.
So it is very painful, but also some people can't completely make a fist, but also some people can't even straighten their finger. So she was at a point where she couldn't straighten her finger. Right now, obviously, she's able to do that, as you all can see. But if you have trigger finger, your finger is going to be stuck like this, bent. So what you should do is get a splint at CEAS or Dwayne Reed and straighten it and tape it down and straighten that muscle, okay, and those tendons in the fingers. That's one way. Another thing you can do is acupuncture. You can also do, relax yourself here, physical therapy. What we're doing here is much more advanced. Okay, what we're doing is cold laser therapy to reduce the inflammation. And again, it's an overuse injury that creates inflammation in the tendon and then causes the finger to creep and close like that, okay? So let's go ahead, and it's your ring finger, correct? Okay. So we're just gonna put some glasses on her.
Yes. And
all of you folks at home that are watching this, can you go ahead and put some glasses on? Just kidding, I'm kidding, don't do that. You don't need to do that, okay. You're not gonna burn your eyes out watching this on video, trust me, okay? So, we're gonna just go right in here with 1,000 hertz just to reduce the inflammation in the tendon. And we use a probe because we want to get right into the tendon and penetrate and get all that laser light into one focal spot. It's much more effective. I found when you don't use a probe like this and you just use the laser head itself, it's not as effective. So we're going to do about a minute in each joint. And again, this is going to reduce the inflammation, increase her range of motion in her finger. And some of you might be thinking, well, why do you have your fingers taped together, Dr. Kulla? I do not have a trigger finger. I have a broken finger. I have an avulsion fracture in my finger. And yes, I have been doing laser twice a day for the past 4 weeks, so my hand heals up faster. And I'm already ahead of schedule by about 3 weeks. Same thing with my shoulder. So this laser really just helps speed the healing process up. Okay, so now that we've finished lasering the ring finger, which is her trigger finger, on the inside of the bottom side of the tendon, and then on the top in the knuckles, we've also done the carpal tunnel region to calm any inflammation down, and in the forearm as well for her trigger finger. Now, there are some stretches that you can go over. Just hang tight right there, okay? And obviously one of them I told you was to straighten the finger out. Another one is to do this. Stretch like this and pull your fingers back while you straighten your arm out. Okay, you can also do it against a wall like this, or against your forearm like this. That's a great stretch. Another great stretch is to do this, to make a fist and ball it up towards you like this, and then take your thumb and hold it on your forearm and then just open your fist like this. take your fist, again, flex it, pull down with your thumb towards your elbow, and then pull the fist back like that. Stretching the ligaments, tendons, and muscles here in your forearm. But again, my favorite is just to do this one. Also to put your hand in a paraffin bath or something really warm, warm compresses to help reduce the muscle spasms in there. If you're in really, really acute pain, typically people would want to use ice. Ice can be helpful for the inflammation, but it's going to cause your finger to do this and to kind of creep down even more. So be careful with that. Okay, we're going to pull this off. Now, she had asked me if I ever had trigger finger before. Being a chiropractor, I'll take your glasses from you. Being a chiropractor, you'd think I would. I use my fingers all day long. Actually, about 2 months ago, I went in to a salon where they do like manicures, pedicures, and I went in with my girlfriend, and the guy was there and said, "Hey, you want a massage? You want a massage?" And of course, it was a Saturday or a Sunday, and I said, "Sure, why not?" So he worked on me on my upper back and my arms, and then he got down to my hands, and he started digging into my forearms and my hands and my. He asked me what I do for a living, and once I told him, that's when he just started going to town on my shoulders and my hands and elbows, and which was fine. And then he got to my fingers, and he started like rubbing them side to side and really getting into there, and it was painful. And afterwards, I left, and I was in so much pain. I ended up having a little bit of trigger finger that day. I got the laser. I lasered it right away because I knew it was inflamed, that he irritated somethings, my tendons. I just knew it. So for about 3 days, I had to laser it, and then it cleared up. And just about a week ago, I was carrying groceries, and I felt it again. So even a rough massage in there can really irritate the tendon. So you need to be careful when you're straightening it out. You just want to straighten it. I don't want you to rub the tendon side to side. Just try to straighten that finger out. And again, she's having a hard time flexing. So what I'm going to have her do is we're going to have her bend as far as she can, and then she's going to do this and pull down and try to make a fist. So you're going to take this hand. So this is the hand you can't make a fist. Do as best you can. And then you're going to take this hand over it, and you're just going to kind of force it shut. Yep. And you'll feel a stretch, and just hold that. It shouldn't be painful. If it's a little uncomfortable, that's okay. And just hold that stretch like that. And I want you to work on that stretch, trying to close your hand into a fist over these next few days to a week. And we'll see you on Monday. And hopefully it's not in the morning when you're allergic.
Thanks,
all right. Thanks for tuning in, folks. And thank you, Mandy, for letting us shoot this video of your trigger finger.